Hello, welcome to Health Talk with Dr. Toyin. Today we'll be discussing hypertension. Hypertension is raised blood pressure. There are three main types of hypertension, which include portal hypertension, pulmonary hypertension, and systemic hypertension. Today we'll be discussing systemic hypertension. Systemic hypertension is raised blood pressure within the body system. Different regions have different cutoffs for diagnosing hypertension, but generally speaking, blood pressure readings above 140/90 millimeters of mercury is considered hypertension. It is known that up to 30% of the world's population have hypertension, but what is even more surprising is that almost 47% of the world's population do not even know they have high blood pressure. So it's advisable, if you're over 40 years, check your blood pressure at least once a month. Now ask yourself, when was the last time I had my blood pressure taken? Taking blood pressure readings might be considered as a form of screening because hypertension generally has no symptoms until it becomes complicated. The complications of hypertension includes things like kidney failure or heart attacks or strokes. Hypertension is not diagnosed by one blood pressure reading, but it needs to be persistently high blood pressure readings that give the diagnosis of hypertension. When using the automated blood pressure machines, if your pulse rate is irregular, it might give a wrong reading, and in that case you need to use a manual blood pressure machine. If you are using the automated machine, if the first blood pressure reading is high, a second one should be obtained at least a minute later. The lowest of the two readings should be taken as the blood pressure reading. In some cases, a third reading might need to be obtained. For some people, they have what is called white coat syndrome, which when they present to a health professional, their blood pressure readings are elevated. In this case, they can take blood pressure readings at home, and if they are normal, then that can be taken as the blood pressure reading. When blood pressure readings are obtained, it's good to take it twice a day, preferably in the morning and the evenings. What are the things that can cause high blood pressure? Well, systemic hypertension is broadly classified into essential hypertension and secondary hypertension. Essential hypertension affects up to 95% of people with systemic hypertension, and no cause is found. In secondary hypertension, there's a cause to the hypertension, and this can include things like kidney disease, endocrine diseases, pregnancy, or medications, which can include things like non-steroidal anti-inflammatory drugs. Corticosteroids also can cause it. In case the blood pressure is elevated, there are some tests that can be done. It is good to assess the status of the kidney, as that can be a cause of hypertension, and also some of the antihypertensives can affect the kidneys. A fasting blood test can be done to assess cholesterol levels and also glucose levels. Diabetes is closely related to hypertension. In diabetics, a blood pressure reading above 135/85 can be considered as hypertension. In essential hypertension, some things that can predispose to it include genetic factors. So if a family member has hypertension, other members can be prone to it. Also, things like diet, like high cholesterol intake, can lead to hypertension. Smoking can lead to hypertension, and it is found that after smoking, blood pressure can temporarily increase 15 minutes after smoking. Smoking too can lead to atherosclerosis, which can predispose to hypertension. Obesity or a high body mass index can also lead to hypertension, and it is found that body weight is related to blood pressure readings. Alcohol intake can also predispose to development of high blood pressure. The use of estrogen-containing contraceptives can also lead to hypertension. So if you're taking these contraceptive pills, you need to check your blood pressure at regular intervals. In case you are diagnosed with hypertension, don't worry, it's not a death sentence. There are medications that can be given, and then there are also non-medical treatments. Non-medical treatments include reducing body weight. As I mentioned earlier, obesity or a high body mass index can lead to high blood pressure. So maintaining your body mass index, if it is between 18 and 25, this will help to maintain a healthy blood pressure reading. Reduced alcohol intake can also help with reducing blood pressure readings. Smoking cessation is also good. As I mentioned earlier, it can also lead to development of atherosclerosis. Good diet with reduced salt intake and reduced cholesterol can also lead to reduced blood pressure readings. Moderate intensity exercise, which includes walking, running, or swimming for at least 30 minutes, 5 to 7 times a week, has been shown to maintain blood pressure readings within a healthy range. In case medications need to be used, there are a wide variety of medications that can be used, which include things like angiotensin converting enzyme inhibitors and calcium channel blockers and diuretics. You might ask, do I need to be on the blood pressure medications for life? Well, it is advised you need to be on them for life to maintain healthy blood pressure. But in case you want to come off the medications, it is good to be done with the help of a health professional, and you need regular monitoring to ensure the blood pressure is maintained within a healthy range. Don't forget to check your blood pressure readings at least every month if you're above 40. And if you're below 40 and you have a genetic predisposition, you might want to also check it on a regular basis. I hope you enjoyed this video. Don't forget to subscribe to my channel so you get updates of new videos. Share this video and increase knowledge. And until next time, smile because it's healthy. Bye!